Hey everybody, thank you so much for being here. I am Dr. P, and today we're talking about what happens to fibroids after you deliver. Well, fibroids are usually here to stay, but we're going to start off by talking about what exactly are they. We're going to talk about how do they change after you deliver your baby. We'll talk about all the symptoms that you may experience after you deliver, and then we'll also talk about treatment options after you deliver your baby. So come on in, let's talk. All right, so you may know exactly what fibroids are because you're here to know how they change after pregnancy. So before we even dive into deeply, I just want to remind you what they are. So fibroids are non-cancerous typically. Fibroids are made from the smooth muscle tissue and just kind of roll into like a little ball, right? And so they grow. They can be as small as a rice grain and as large as an orange, even bigger than that too. But these fibroids are usually produced somewhere in your reproductive years. So once you get through puberty and your hormones for your ovaries and your brain that signals to have periods, all those hormones rise in your system, these fibrotic tissue start to grow. And they can grow anywhere from 1 to 2 centimeters per year, as early as 12 or 13 years old. And they may develop and start in your 30s. It is hard to say, but we know that 70 to 80% of reproductive age females by the age of 50 will have fibroids. That's the majority of us. And so the likelihood of you knowing that they're there during pregnancy exists. A lot of people won't find out about them until they're pregnant. And so once you start thinking about the delivery, you want to know, well, what happens to these fibroids? Before we get to that conversation fully, know that during early pregnancy, fibroids are more than likely to grow. They're more than likely to increase in size. They're more than likely going to get to a point where they can have degeneration, where they change form, and that can lead to pain and other symptoms as well. We know that as you go towards the end of pregnancy, they may stabilize a bit, where their growth may slow down. It's just not as many changes because your body is in a more stable place during your second and third trimesters, and then you deliver your baby. And that could be the most beautiful experience there is. You can have a vaginal birth even with fibroids. You may need a cesarean section for a variety of reasons. It could be because your baby is malpositioned, like your baby's breech. It could be that your labor stopped where you were contracting and dilating, and then it no longer continued and progressed. And that could be because of fibroids as well. Sometimes it could be because fibroids are in the way where baby needs to exit through your pelvis, and the fibroid is there blocking baby from passing through, leading to a C-section. So there's so many different reasons, but you've gotten to the place where you've delivered your baby either vaginally or by cesarean, and now you want to know, well, what happens to these fibroids? Well, after you deliver your baby, your hormones tank. All the estrogens and the progesterones and the HCG and all the hormones of pregnancy completely start decreasing in your system the minute your baby exits your body, regardless of whether or not it is by a vaginal delivery or a cesarean section. Your hormones will start to plummet. In many cases, once your baby is out, your fibroids may actually start to shrink. The studies have shown that somewhere between 30 to 70% of fibroids postpartum within the first 3 to 6 months will start to shrink in size. And yes, that sounds amazing. It's a beautiful thing. Everyone wants smaller fibroids. I mean, I'm sure you would probably say get rid of them, which usually doesn't happen, but we know that they will shrink in size, especially if you are breastfeeding. Studies have shown that the longer you're breastfeeding, the less hormones are being fed to your fibroids. And so when they don't have a lot of hormones and a lot of blood flow, they shrink in size. Now think about this. If they're shrinking when you're not having cycles and when you're breastfeeding, imagine you stop breastfeeding or your cycles have returned. If your cycles have returned, the amount of hormones and blood flow to your uterus have returned as well. And so what can happen at that point is that you may start to see the reverse of the shrinkage that initially happened postpartum. We may also notice that you have some degree of degeneration or change in the fibroid composition in a postpartum state as well. Degeneration is almost like a breakdown off the fibroid tissue, which again sounds amazing, but the problem is that it often comes with pain. It can come with discomfort. It may show, or you may notice, inflammation throughout your system because of the processes that are happening within or internally in those fibroids. I also want to note that postpartum, because of the shrinkage of your fibroids, if you've ever had problems with pressure from your fibroids, if they're shrinking, you'll have some relief there. If you've had heavy bleeding because of your fibroids, postpartum, if they're shrinking, you may notice improvement in the bleeding as well. If you've had urinary frequency, meaning that you're peeing all the time outside of the changes that we expect with pregnancy, or you've had a ton of constipation and we've identified that this is due to your fibroids, when they shrink, those may improve as well. Now, while you're in a postpartum state, I always recommend following up with imaging. Again, the likelihood is you found out about the fibroids during your pregnancy, or maybe you knew before. Now, postpartum is a really good time to get another ultrasound and take a look at what those fibroids are looking like. I wouldn't recommend that we do this too early postpartum, but give yourself at least 6 months, maybe even 12. Establish your breastfeeding routine, establish your postpartum care, let your cycles resume and kind of see what those are like, and then get that ultrasound, because the effects or the shrinkage that can happen with your fibroids are not going to happen overnight. Right? This is going to happen over time as you go through your postpartum course and your hormones are reestablishing themselves. So you want to give your body some time to really settle in that state. And now, while we think of postpartum as 6 weeks after you deliver, I completely disagree with that, but this is what we tend to use as our guide. Really, postpartum states last about 18 months. And so if we wait even closer to the 18-month mark, you'll get a better picture of what your fibroids look like currently, the change that has occurred postpartum, and if you've had any new growth or any new presentation of fibroids, you'll be able to see that best at that time. Now, just like before pregnancy, if you had symptoms from your fibroids, it is really good to start having that conversation with your doctors about treatment options, management of your symptoms postpartum. And in general, I always advocate and recommend that you initiate these conversations before you even deliver your baby, right? So we should know a good overlook of what to expect during pregnancy when you're having those conversations with your doctors. Also talk about your delivery and what that may look like. Talk about all the risks, the likelihood of getting a cesarean section, the likelihood of baby not being in the right position or descending like it should in the pelvis. Discuss all of these things before you actually get to the point of labor. And then also have another conversation about what life can be like for you postpartum, knowing that you have these fibroids, expecting some shrinkage in them, and what your course may look like. In addition to all of this, talk about management options as well. Sometimes it might be a good idea to discuss surgically removing them or come up with a plan as to when would be safest to do so, especially if you're thinking about a future pregnancy. It is a good time to talk about managing your symptoms like heavy bleeding or pain. Are you going to consider hormonal options? Do you need to make lifestyle changes that can potentially lead to continued shrinking of your fibroids? Have these conversations for your delivery if you can, but have these conversations now. If you're with these issues, the earlier that we can talk about options, the better your outcome and your lifestyle and the impact these fibroids will have on your life. I'm so glad you're here listening in and that we can talk about these things that affect a majority of us. This is a safe space and I'm glad that you're here. And listen, I think that there are some more videos that might be helpful. One in particular I've listed here in the description of this video. Click on that and come with me to discuss this topic a little bit deeper today. Thank you so much for listening. I'm Dr. Perkins again, and I'll see you at the next video.